The way that I measure outcomes is really threefold, I guess. I have the anecdotal feedback from the person undergoing therapy, and of course that's of utmost importance that they're seeing a change in their quality of life. I also have objective findings that change, so I could do standard orthopedic tests or range of motion, let's say, with a shoulder or a hip or a knee or the spine. And so that's really obvious, and anyone who's been in practice for a while has some tactile capabilities in terms of palpation sensitivity. And you can really feel the tone of the musculature change, you can feel the texture of the soft tissues change. And the patients are typically quite aware of that themselves. They'll come in and they're reporting that when they walk in the door. And I also do a lot of blood chemistry in my office. And particularly, I do all the regular metabolic panel, complete blood cell count, etc. But I'm always interested in inflammatory markers. In this case, a high sensitivity C-reactive protein is the most sensitive test you can order for systemic inflammation. Any chiropractor or any physical therapist, anyone who's doing physical rehabilitation of any kind, will tell you that inflammation, in terms of their level of inflammation, is going to be the thing that slows down their progress more than just about anything else. Maybe oxidative stress could be thrown into the mix there, which drives inflammation anyway. So I look at C-reactive protein and thyroid function, and I also always check iron levels to make sure they're not anemic before getting into the therapy, because that would certainly slow down their progress or negate it significantly. And vitamin D deficiency is very, very common. And also, if you don't screen for that as a clinician, you'll get, in a lot of cases, you'll get a lot slower results using photobiomodulation than you would otherwise. And the same thing goes for just straight up manipulative therapy or chiropractic care or physical rehabilitation of any kind. And I have seen that in many, many cases. C-reactive protein levels are significantly lowered after 12 to 24 treatment sessions of the NovoTHOR. I don't see that at all with the handheld unit. I've never seen it to any extent. That's even treating over the shins and sternum. I've experimented that way with a lot of different patients, and I don't see those changes. I've seen thyroid function improve significantly, particularly with one marker called reverse T3 that should not be elevated, and I've seen that lowered. I've seen several people with improved lipid levels, which is to say cholesterol, triglycerides. I suspect that that's because of improved insulin sensitivity. I have seen changes in hemoglobin A1C. And so they're fairly consistent, actually. I don't know what percentage. It's not 100%, but it is. It's not uncommon, and it's definitely more than 50%. So I've been very interested to see that, and patients are always very interested to see that, especially when I do it as kind of a clean experiment, meaning that's the only variable. I'll bring in that modality, and I don't change their diet. I don't give them any nutritional supplementation, and just to see what the photobiomodulation can do on its own. I think one condition that stands out, for me at least, is the peripheral neuropathy. The patients that I've had with peripheral neuropathy coming in that have, say, as a consequence of chemotherapy or a consequence of type 2 diabetes. So far, I will say that I've not had a single person with neuropathy not improve. Still have 100% success with that, at least a significant degree of improvement, and a lot of them are full resolution. Even in those cases, I usually do some glucose support, some omega-3 fatty acids, alpha-lipoic acid, and a few nutraceuticals that way. But just to test the efficacy of the therapy on its own, and several of them, at least a dozen, I've delayed bringing in any clinical nutrition at all or any dietary advice at all, and just started with photobiomodulation just to see what it could do as a variable, and it's impressive every time. And that's using markers like pre and post blood chemistry, but also my own objective findings during physical exam, and of course there's subjective symptomatic improvements as well.